Introducing the newly designed multi-purpose cannula. As we all know, hydrodissection is an important technique for successful cataract surgery. This film will show you a unique cannula, useful for hydrodissection and other techniques involved in cataract surgery. This cannula, with water shooting out of its two holes, will facilitate speedy hydrodissection. Dr. Inamura created a smooth, round-tip cannula, gentle to delicate tissue, and with two circular holes at the tip, with some distance between them. This distance was adjusted to create a 30-degree angle between the two spurts of water. A relatively large volume of water can be delivered through this cannula. Therefore, a 10mm syringe usually works well. This cannula can be used for both irrigation and aspiration purposes. Let's compare this to a 27-gauge blunt needle. This shows a conventional 27-gauge blunt needle. And this is the Inamura cannula with its double spurts of water. This cannula was initially designed for hydrodissection. This shows how swiftly the hydrodissection is completed after a single injection, and how easy it is to rotate the nucleus. A single injection is often not enough to complete the hydrodissection. However, with the Inamura cannula, the double spurts of fluid swiftly engulf the lens capsule, and in most cases, the nucleus can be rotated after a single injection. The fluid is injected directly underneath the anterior capsule. Plenty of water can be delivered through this cannula, making it an ideal instrument for cleansing the surgical field. This shows how meibomian gland secretion can be washed away effectively to avoid endophthalmitis. This demonstrates the difference between these two needles when aspirating Hyaluron 5. It shows how effectively the Inamura multi-purpose cannula can aspirate dense material. Next, a demonstration of 3 aspiration techniques with this cannula. Air bubbles are sometimes injected into the anterior chamber along with viscoelastic material. These bubbles can be quite pesky. Trying to push them out with viscoelastic injection or to aspirate them with a regular blunt needle can be quite a task. However, with this Inamura multi-purpose cannula, these air bubbles in the anterior chamber can be aspirated with ease. Even these tiny bubbles can be easily aspirated. This technique comes in handy in mature cataract cases. Here the anterior capsule has been stained with trypan blue prior to CCC. After puncturing the anterior capsule with forceps, the liquefied cortex is being aspirated. This makes all the difference in maintaining a clear operative field, and by lowering the lens pressure, it makes the following CCC much easier. In this case, The lens was almost completely liquefied, and the milky material was totally aspirated away. This patient was taking tamsulosin at the time of surgery. Due to intraoperative floppy iris syndrome, the iris has prolapsed and become lodged into the incision at the end of surgery. How should this situation be approached? The sight of a prolapsed iris gives us the urge to try to reposition it using a spatula, which is not a good idea because this may damage the iris and make it more likely to keep on popping out again. The important thing to do is to try to lower the pressure inside the anterior chamber. By inserting the Inamura multi-purpose cannula into the anterior chamber with an empty syringe attached and aspirating some of the aqueous humor, this is quite easily accomplished and the iris is repositioned. The trick is to create a sudden negative pressure in the anterior chamber, thus letting the prolapsed iris get sucked back inside. In this way, the iris is repositioned by simply aspirating the aqueous humor. This is a different case. Here also, the iris has been repositioned almost automatically by aspirating the aqueous humor. As we have demonstrated, this Inamura multi-purpose cannula can be very useful for hydrodissection and many other types of situations. The Inamura multi-purpose cannula was initially designed for hydrodissection use, but by actually using it in daily surgeries, it was found to be helpful in multiple situations. It could no doubt be of assistance to you in unexpected ways.